So here we have short axis view of the supraspinatus tendon. This is one of the two very important images of the shoulder. You need to be very proficient at this because lots of rotator cuff imaging is going to occur. So we put the patient in the modified CRAS position. You'll see in the photograph the probe is short axis, but it's also parallel with the floor. There's no need to angle the probe from the floor up, thinking I have to angle my sound beam up under the acromion to see supraspinatus. It's not there anymore. Because of this, we brought supraspinatus anterior out away from under the cover of the acromion, so it's not there anymore. So the probe is short axis, parallel with the floor. Bony landmark, this broad convexity of the humerus is called the tire on the rim view. So you find the rim first, put the tire on the rim, one interface at a time. So humeral cortex is first, black anechoic layer of hyaline cartilage. From here to here, the bright hyperechoic fibrous ecotexture of a normal supraspinatus tendon. This is the potential space for the subacromial subdeltoid bursa. Remember, if it's normal, we shouldn't see much, correct? This is a combination of peribursal fat and deltoid fascia. This is the bands and bundles of the deltoid, subq, and skin. That's each individual interface. The grayscale changes up or down that scale can be appreciated. So this is called tire on the rim, one of the important features of the shoulder examination. So along with the grayscale changes of the supraspinatus tendon, on this image we can appreciate some measurements. At the apex of the rim, not including the hyaline cartilage interface, nor do we include the bursal interface, we measure the thickness of the supraspinatus tendon. If it's less than 6 millimeters in thickness at the apex of the rim, it's indicative of thinning and degenerative changes, or what we call volume loss, as the rotator cuff begins to fail. If it's greater than 6 millimeters, it's an indication that the cuff is edematous, it's inflamed, or it's experiencing what we call increased cellularity. Increased cellularity is one of the three criteria that we're going to discuss relative to this condition known as tendinosis. One of the things that you're probably never going to identify is tendinitis. Tendinitis is a fleeting entity. The tendon quickly goes out of this acute inflammatory phase into a progression of tendinosis. As it goes through tendinosis, it becomes, basically two things happen right away. The tendon is no longer hyperechoic, it becomes hypoechoic, and it becomes thicker. So you have a dark, hypoechoic, thick tendon. There are your two visual criteria for tendinosis. Increased cellularity, the thickening of the tendon due to tendinosis is how we describe that thickening. You have a proliferation of abnormal tissue within the tendon sheath. So we'll talk about tendinosis a little bit more later. In addition to measuring the thickness of the supraspinatus tendon, you can also, because we identify one interface at a time, we can appreciate whether or not we have greater than 2 millimeters of fluid within the bursa that sits right up on top of the tendon. So we identify, again, that interface of the bursa, 2 millimeters or more, a way for you to quantify subacromial subdeltoid bursal effusion.